Good morning, everyone. Welcome. My name is Reshmi Srinath. I'm an associate professor here at Mount Sinai in the Division of Endocrinology, Diabetes, and Bone Disease. Here we're going to discuss about diabetes medications and their growing interest. So there are numerous medications now on the market for diabetes. I would say our mainstay is a medicine called Metformin. Metformin is a pill developed many decades ago. It actually works to relax the pancreas, which is our main organ that helps to produce insulin. It also helps the liver, reducing the amount of sugar being produced in the liver, and has an effect on lowering appetite. So Metformin is our gold standard. It is the medication we start for any patient who has, prediabetes or type 2 diabetes that's uncontrolled. The medication works quite well and works both to lower appetite, help with blood sugar control, and has other benefits, including lowering inflammation, helping reduce certain types of cancers, and numerous other benefits we're still learning about. So that's sort of our gold standard. There are other pills that have been developed over the years that also help to control and regulate blood sugar production. I want to focus on newer medications that have been developed over the last decade, which work on the gut. So these are injectables that are daily or weekly injections that target a hormone that comes from your small intestine called GLP-1. These medications help to both help the pancreas do its job, which is control blood sugar and produce insulin, but they also have a significant benefit on weight loss, and they help to slow the way the food goes to your gut and your intestine, so you're eating less, you're feeling fuller quicker, and your blood sugars are controlled. So this is a growing class of medications that have gotten a lot of interest and are very beneficial. There are also another class of medications I want to mention which work on the kidney. These are called SGLT2 inhibitors. These are pills that help to relax the kidney. They help the kidney filter sugar. They also have a benefit in terms of helping your pressure, your blood pressure. They also can help with weight regulation, and numerous studies have been done which show benefit on the heart and in terms of reducing stroke risk. So again, another wonderful class of medication. So again, numerous medications we have in the market right now, and not to mention insulin, which is probably our most potent medication that helps to regulate blood sugar control. So most of the medications on the market are quite effective. They help to lower your blood sugar and help to lower a marker called hemoglobin A1C. So just in terms of definitions, hemoglobin A1C is a diabetes risk marker. Values over 6.5% correlate with type 2 diabetes. Values between 5.7 and 6.4% correlate with prediabetes. And this is something that is very important for our patients to know. We know that majority of these medications do help to lower that hemoglobin A1C, but about 1% up to 2%. For sure, insulin can do this, metformin can do this, and some of these newer injections that I mentioned that help work on this gut hormone called GLP-1 actually can even lower that hemoglobin A1C by more than 2%. So we are in a really exciting time. And the benefit by lowering that A1C by more than 2% is glucose lowering of over 30 to 50 points, which is really significant and help patients who are presenting with uncontrolled diabetes who really need the help. So the majority of medications that I mentioned earlier, which work on the gut, again, the most common side effects of these injectables that work on GLP-1 are GI side effects. So people describe bloating, potential flatulence. Because the medications slow the way the food goes to your system, you are feeling fuller quicker, but they also can activate reflux, gastric reflux. They can activate constipation and potentially worsen constipation. So many of our patients note they feel fuller quicker, but they also have developed constipation or some of these other side effects. Medications that I mentioned called the SGLT2 inhibitors work on the kidney. People can describe feeling more thirsty, that they're peeing more than they used to. Once in a while, patients do also describe feelings of or development of urinary tract infections or yeast infections, both in women and in males as well. So these are things to watch out for. In terms of metformin, our gold standard, again, very well tolerated. People do describe some GI side effects in terms of some stomach upset, nausea. Usually that goes away within the first week or so. And in terms of side effects of insulin, really well tolerated. The main risk with insulin is making sure patients aren't developing low blood sugar due to too much insulin being administered. So it is very important that we take medications when we have a diagnosis of type 2 diabetes. We know that diabetes is tightly linked to risk of heart disease and risk of stroke, which can be associated with greater mortality and morbidity. We know that diabetes, when uncontrolled, can lead to complications, whether those affect your vision. People describe having blurriness in vision, double vision, and potential blindness. Potentially also can affect the kidneys, so worsening kidney function and potentially kidney failure. Diabetes itself can lead to symptoms of numbness, tingling in the hands and feet, and that can eventually lead to a condition called neuropathy, where patients can actually lose sensation in their extremities, particularly the feet, and that can lead to risk of injury and potentially foot ulcer and potential amputation. So these are complications we definitely want to avoid. And I think the first step is really being vigilant and prevention, which is taking your medications, being closely monitored by your physician, and monitoring your blood sugar. So a lot of these medications have been in the news recently because we know that they both help to manage type 2 diabetes, but they're also doing a lot in terms of helping us with weight loss. We know that weight is a risk factor for type 2 diabetes. So by helping patients lose weight, we can prevent them from developing type 2 diabetes down the line. So the medications that I mentioned earlier that work on the gut, these what we call GLP-1 agonists that work on GLP-1 from the small intestine, have been in the news. And you may have heard of drugs like Ozempic, Mounjaro. These are injectables that both, again, work to help control diabetes, but also have significant weight loss benefits. And the good news is that these are drugs that are being now marketed for weight loss, and we now have FDA-approved versions that are being developed for weight loss. So Ozempic has now what we consider a companion called Wegovy. Wegovy and Ozempic are both known as semaglutide, which is a generic version. These are both medications that work similarly. They're the same drug, but Wegovy is approved for weight loss and Ozempic is approved for type 2 diabetes. Similarly, Mounjaro, which is one of the newest drugs for type 2 diabetes, is being now tested for weight loss and obesity, and most likely is going to get FDA approved for weight loss potentially in the next 6 months. So there's a lot of excitement. Yeah, so I think this is really a conversation for you to have with your provider, whether that's your primary care doctor, whether that's your endocrinologist. We know, as I mentioned earlier, obesity and weight gain is a risk factor for type 2 diabetes. So it's really, really important that you keep an eye on your blood tests results, on that blood sugar. We typically assess diabetes risk by looking at that fasting blood sugar and looking at that hemoglobin A1C. And sometimes patients even do a glucose tolerance test, which is another way of determining if patients have diabetes risk and risk of type 2 diabetes. So for patients who definitely have diabetes risk, it's important to have a conversation about your weight and whether you might be a candidate for some of these medications, which are FDA approved for obesity. I think that more and more as of this year, many of the medications that are approved for type 2 diabetes are being closely regulated by the insurance companies. So it is now getting harder to get these drugs just purely off label. So again, this is a discussion for your doctors and to really discuss what is your diabetes risk, where do you stand, and what would be the next treatment that would be best for you. So again, talking about these medications, we know that they're all very beneficial. They all have side effects, and we know that everyone doesn't always respond to them. I've had numerous patients who have tried some of these newer medications and either don't have the response they want or have a lot of side effects. So again, this is just points to the fact that we should have ongoing discussions with your doctor, really closely monitoring your diabetes risk or the level of diabetes that you have, whether it's type 2 or type 1, and where you stand in terms of medications you use and whether other medications might be better alternatives that can help both with managing your diabetes and weight if that is a concern for you.